So myopia is also referred to as nearsightedness more commonly, is a very common condition that we see all the time here at Malera Eye Care. It's one of the most common reasons that a lot of you out there need your glasses or your contacts. And for most people, myopia is never a huge issue. It's just something you correct your vision and you go on with your day. But in a lot of cases, when myopia gets too high, we can see a few problems, especially at the back of the eye, at your retina. Some of these problems consist of higher risk of tears and detachments to your retina, which can actually be blinding conditions, and other different, more in-depth things like choroidal neovascularization and lacquer cracks, which are just terms that we use to describe damage that is occurring at the very back of the eye. Now, to prevent these things from happening, one of our best ways to do it is to prevent you from ever becoming so nearsighted. So whenever we see a younger child, usually anywhere from the ages of 5 or 6 up to around 14 or 15, who's showing a tendency to develop into this high myopia, there's two different ways we can try to slow it down. The first way is with what's called ortho-keratology, with a corneal reshaping therapy. And what this does is it reshapes the front of the eye with a hard contact lens that you sleep with overnight. And this reshaping allows you to see clearly during the day, first of all, and secondly, it also has been proven to slow down the progression of myopia. The second way to do it is with just a simple eye drop that you would take generally once a day, but we would give instruction on that. And there's different concentrations we can use on a person-to-person basis. And this has also been proven scientifically through several different studies to slow down the progression of myopia. And this is what we would call myopia control. Both services are offered by us here at Malera Eye Care. We see a lot of good success with it, and it's definitely a rising field in this era of advancing screen time and computer time, where we see nearsightedness really becoming a problem in today's populations. So this is definitely something that you might hear about us speaking at your exam or at any of your children's or other family members' exams to look for in the future.